As we mark World Mental Health Day today, a new program is helping fill the mental health gap for young adults. Homewood Ravensview has launched Canada's first and only mental health addiction treatment program for adults 19 and older. Deanna Brady is Vice President and General Manager of Homewood Ravensview, and Craig Eckstein is Manager of Clinical Operations with Homeview Ravensview. And they both join us this morning. Thank you for coming here, for being with us.
Thank you for having us.
Deanna, we're going to start off with you. The program is called My Path. So who is this program for, and then how is it different from other programs that are being offered?
Thank you. The My Path program at Homewood Ravensview, it is tailored for young adults, those young adults that are facing unique challenges. The program provides treatment for those that are struggling with diagnosis of post-traumatic stress disorder, depression, anxiety, substance use, and process addictions. Within this program, we adopt an inclusive and supportive approach to addressing issues and challenges that are related to the transition to adulthood. We support and facilitate conversations about sexual and/or gender identity, as well as understanding that question about who am I, and what is my identity, and what is my path in life. The other key piece with our My Path program is that we provide a comprehensive assessment that incorporates findings from psychiatry, psychology, occupational therapy, and other clinicians on our team. This client can then use the assessment to support applications for disability benefits, vocational accommodations, and career path planning.
Can you tell us a little bit more about Homewood Ravensview and why somebody who needs help should be considering your specific treatment center?
Yes. Homewood Ravensview, for first, the location, we're located on beautiful Vancouver Island in British Columbia, and we offer one of the most comprehensive mental health and addiction treatment in Western Canada. We use an evidence-based approach that, again, provides treatment for those diagnoses explained above, and in addition to that, chronic pain and concurrent disorders. We have specialized programs. In addition to the My Path, we have a Cornerstone program for adults age 19 and above, and we have a Guardians program for those identifying as having military veterans or first responders. So that really helps us to meet the unique needs of our clients. One of the other treatment approaches that we use is measurement-based care, and that helps to evaluate a client's baseline at admission and then help to monitor their progress in treatment in real time. And it also helps to keep the client involved in their treatment. Homewood Ravensview is part of Homewood Health Incorporated, and we're one of 3 inpatient treatment facilities, with our largest being in Guelph, Ontario, and that's based on 140 years of experience.
Craig, I wanted to touch on your expertise and your experience. How can somebody spot the signs that a child may need professional support, and how much of a role does a loved one play during and after the treatment program?
Sure, thank you. I can speak to that. So, if there's any suicidal thoughts, problems with substance use, if there's a decline in functioning at school, work, or at home, these are all signs that professional help should be sought, and always a good idea to involve a family physician and professionals as soon as possible in the assessment process. We involve family throughout the treatment process, from before the time of admission, during the early stage of treatment. Is very important for assessment, for us to help understand what's going on for the loved one. And then as treatment progresses, we provide updates, but we really value the perspective of the family to let us know what are they noticing as far as progress or as far as areas where there's maybe a lack of progress.
Wonderful. Great information from both of you. Deanna and Craig, thank you so much. For more information, the website is ravensview.com.